Loka samastaha sukhino bhavantu. Om Shanti, Shanti, Shanti. An ancient Indian prayer in Sanskrit. In all of creation, may joy happen and let there be tranquility. I am Dr. Vijay Aldandi, a specialist in infectious diseases and public health. This presentation is a tribute to some unsung heroes, my favorite healthcare professionals, nurses. Let me tell you why. At the age of 2, I became a paraplegic due to poliomyelitis and spent many months in the Mahalakshmi Children's Orthopedic Hospital in Mumbai, away from my own loved ones. So the only family I had were the kind nurses at the hospital, whose memories I still cherish. Later on in my career, training to become a physician, it was nurses who taught me how to give a hypodermic, how to draw blood, how to put down a nasogastric feeding tube, how to place a urinary catheter, how to start an intravenous line. And as a resident in internal medicine working in the intensive care unit during the night when there was an emergency and there was no cardiologist around to help me, it was the skilled nurses who taught me how to interpret complex cardiac rhythms. So for over 6 decades, I am a witness to the selfless, dedicated care and the kindness of nurses for countless patients throughout the world. You have been my caregivers, my teachers, my collaborators, and without you, my patients would not get the quality of care that I wish to see. I have been teaching prevention of infections for over 3 decades and also patient safety for over 10 years. And I always found the nurses to be the most receptive and willing to learn and adopt best practices. In this presentation, we'll talk about Florence Nightingale, the founder of modern nursing and an icon for all of nurses. It was during the Crimean War that Nightingale gained the nickname the Lady with the Lamp, and this came from a newspaper report in the Times, which I will read to you. She is a ministering angel, without any exaggeration, in these hospitals. And as her slender form glides quietly along each corridor, every poor fellow's face softens with gratitude at the sight of her. When all medical officers have retired for the night and silence and darkness have settled down upon those miles of prostrate sick, she may be observed alone with a little lamp in her hand, making her solitary rounds. In 1857, the poet Henry Wadsworth Longfellow composed the poem Santa Filomena. Lo, in that house of misery, a lady with a lamp I see, pass through the glimmering gloom and flit from room to room. I know, for all nurses, she is forever a vision of a kindly lady with the lamp. And undoubtedly, for patients, kindness and a little light is a key to the efficacy of their medical care. But I would like to remind you of many other attributes of Florence Nightingale that shaped the science of patient safety and infection prevention, and why I consider her one of the most important leaders in healthcare. Florence Nightingale was born on the 12th of May, 1820, and lived until 13th of August, 1910. In addition to being a nurse, she was a social reformer and also a gifted mathematician, a statistician, and a very articulate, persuasive, charismatic personality. Not only did she become a nurse much against the wishes of her family and society at large, but she also received 4 months of medical training at the institution of Kaiserwerth on the Rhine in Germany, thus acquiring knowledge and skills that helped her with her work as a nurse. The historian of science, I. Bernard Cohen, said, and I quote, "Nightingale's achievements are all the more impressive when they are considered against the background of social restraints on women in Victorian England. Her father, William Edward Nightingale, was an extremely wealthy landowner, and the family moved in the highest circles of English society. In those days, women of Nightingale's class did not attend universities and did not pursue professional careers. Their purpose in life was to marry and bear children. Nightingale was fortunate. Her father believed women should be educated, and he personally taught her Italian, Latin, Greek, philosophy, history, and most unusual for all women of the time, writing and mathematics. Nightingale became most famous for her work during the Crimean War. During her first winter at Scutari, which is part of Istanbul in Turkey, in the hospital caring for the war wounded, 4,077 soldiers died. 10 times more soldiers died from illness such as typhus, typhoid, cholera, and dysentery than from battle wounds, probably due to overcrowding, defective sewers, and lack of ventilation. Nightingale set about systematically recording the statistics of the conditions of the soldiers, and she knew that these had to be presented in simple and easy to understand diagrams. So she presented the data in pie charts that she called coxcomb diagrams. In these diagrams, the red part represents the deaths due to battlefield wounds, with the black part due to other causes. However, a much larger number of deaths in blue are due to preventable causes. Nightingale was convinced that just improving sanitation and ensuring soldiers received clean clothing, clean bandages, proper food, and proper ventilation were essential to their care. Because of her very persuasive advocacy, she was able to effect changes in the conditions of the army hospital, thereby bringing down the deaths of the convalescing soldiers. In 1859, Nightingale published the first authoritative text on modern nursing, Notes on Nursing, what it is and what it is not. And in the preface, she writes, "Every sanitary knowledge, or the knowledge of nursing, or, in other words, of how to put the constitution in such a state as that it will have no disease, or that it can recover from disease, takes a higher place. It is recognized as a knowledge which everyone ought to have, distinct from the medical knowledge which only a profession can have." In 1859, Nightingale was elected the first female member of the Royal Statistical Society. In 1874, she became an honorary member of the American Statistical Association. She also evaluated the health of the British Army in India and described bad drainage, contaminated water, overcrowding, and poor ventilation. Nightingale campaigned to improve the sanitary conditions of not just the army, but the country, particularly rural areas. She helped to introduce improved medical care and public health in India. After 10 years of reform, in 1873, Nightingale reported that mortality among soldiers in India had declined from 69 per thousand to 18 per thousand. So when I see nurses working with patients everywhere, I see the spirit of Florence Nightingale. So I salute you and thank you for your sacred work. And I hope all of you will become leaders in improving healthcare by reinforcing what we have learned from Florence Nightingale. Clean and fresh air, clean hands, and a clean environment. Still the most effective way of keeping our patients safe and helping them recover. I believe that nurses should never be considered subordinate to any other healthcare professional. So, please take charge. And remember, power is an illusion. Authority is a delusion. Responsibility is reality. And once again, I salute you and thank you for your dedication and service to humanity.